Thank you so much, ABPN, for hosting this panel around care economy. I think that really, really needs a lot of attention. And it's an honor to be here with these esteemed panel of power pack women championing gender equality work for a long time. And I think what we'll talk about in this panel is, was just highlighted the unskewed care burden that falls on the women and how it has left them out from the economic workforce and what really needs to be done to ensure this lost opportunity can be converted into a big economic opportunity, but at the same time bringing back women also into the workforce. Am I clear now? Okay. To really bring the women back into the workforce through new business, models, new care economic innovation that we can see into this, and how do we drive also more attention in the investment into the care sector. So I think we'll talk about the challenges the sector has seen. We'll also, in this panel discuss the opportunities ahead. How do we see this ecosystem really grow? So we have panelists coming from different backgrounds, very diverse point of views, diverse experiences of their work that we'll get to hear. And then we'll also take questions from audience, listen to your point of views, and for the panel, and we'll summarize and try to wrap it up. So with that, without any further ado, what I would do is put forward our first really question around the challenges and how some of these, panelists look at the investing into the care sector and the challenges they face, either as a, if they seek support from investors into the care in the work they are doing to on women empowerment. So starting with Radha, the first question is like, Radha, how do you see, you know, your investing philosophy at RPG Foundation when it comes to supporting into the care work, and throw some light more about the work that you've been doing, very specific to the care, and how is it leading to women empowerment, economic empowerment?
Thank you, Anurag, and AVPN for inviting me here and throwing light on such an important subject, which is the care economy. Our actual intervention in the care economy happened by chance. At RPG Foundation, we are huge supporters of financially empowering women, and I think that's something a lot of us here will connect with. That financially empowering a woman is not only good to bridge the gender inequality gap, which I just read recently somewhere, we are 132 years away from a gender equal world. So that number is just really sad. But financially empowering women is not only going to help us bridge that gap, but it's also something that will change society as a whole. Because women, we know that as soon as they are financially empowered, they will invest in their children's education, in nutrition, and actually help to break the poverty cycle in so many ways. So financially empowering women is something that we believe in, and we have a program called Swayam where we skill women. And in that journey of skilling, we realized our internal benchmark has been always to not only skill women, but to ensure that they get placed in jobs. We have an internal benchmark of 90% women that we train must get jobs, which led us to the care economy. That's where the demand was, that's where the jobs were. So that's our journey in the care economy. The challenges that we faced and kind of bridged along the way, one was that we realized that women didn't have certifications. So, we employed, or rather generated, programs where it was at the baseline of the care economy. There were assistant jobs that they were trained for, and it just led to a huge transformational impact in their lives.
Thank you, Radha. I think there's a lot about skill development and the, upskilling of women that Radha focuses on at her work. And then we have Sumitra ji here from Mobile Krishers. Their work is really almost 5 decades of working at the grassroots, but also a lot of work with the government. So my question to you would be, Sumitra ji, is what challenges and opportunities do you see, among investors when it comes to look care from a new lens, where how would you like them to really support this sector? And at the same time, how do you see investing in the work that you've done in the childcare space as a win-win, value proposition for investors to come and see it, from a new perspective.
Thank you, Anurag, and thank you, AVPN colleagues, for holding a panel on care economy to begin with, but also having all of us here. So yes, Mobile Crushes has been in the business of childcare for a very long time, running as a model setting organization, running services directly, but also in scaling up childcare services in partnership with the national and state governments, employers, and other civil society organizations. As we speak today, around 1,000 odd such childcare services across the country is being supported through the Mobile Crushes infrastructure and knowledge. So it is from this experience of interacting with investors, funders, interested stakeholders in the ecosystem that I speak about three big challenges that we have experienced, and maybe some of you will relate to that also. The first big challenge for investment in childcare particularly is that childcare is an expensive business. It doesn't come cheap. The return on investment needs a far longer maturation time. It needs patient capital. This is not about just output metrics. It needs outcome mapping. And a service of childcare is not an input that will immediately lead to greater women's workforce participation, because it's a complex, nuanced subject, as we've been listening since yesterday. And a long-term investment in childcare leading to child development, early child development outcomes, also needs a staying power. And therefore, it becomes a difficult propositions for investors who want to track metrics quite quickly enough. Just as a point of reference, Government of India's childcare service scheme spends roughly under 50 rupees per day per child in the childcare services. Compare that to a Mobile Crush minimum standards model, which is 3 times 150 rupees per day per child. So point is that it is expensive and it needs a serious commitment to stay the long haul. The second thing that I want to point out is why piloting and the journey from piloting to scaling to sustainability of childcare services is difficult, is because services for children under 6 years operates in a regulatory vacuum in the country. There are no norms and standards, there are no guidelines, there isn't a regulation mechanism, there isn't a national care policy that intersects labor, skilling, gender equality provisions, and the child development outcomes. So there is a governance scaffolding that is missing, and that means that has mostly been due to limited political currency. And that is another reason why investors willing to pilot and see the sustainability journey get discouraged to stay the long haul. And the third challenge is actually the elephant in the room here. Care is feminized. Disproportionate unpaid care burden on women is taken as a given, and we've heard enough about that in the last 2 days, and we know about experience about that. The investment community, the funding decision community, is a subset of the larger sociocultural generation that we live in, the world that we live in. So any investment into care, particularly childcare, is seen as a woman's job, a family's private affairs. It's not a smart case for business investment. And that's something that we've experienced repeatedly. Just very quickly moving on to the opportunities. However, given that AVPN is prioritizing care economy, what are the big opportunities available? COVID, for all surprises, has been the tipping point for care economy, because middle-class households experience the burden of care, domestic and child care burden at homes without the availability of paid care services. So suddenly, care and child care has got the spotlight. So this is our moment to seize, which also means that in the global macroeconomics, care economy is being prioritized because care jobs is being seen as the next biggest job creator. Care entrepreneurship is being seen as a big macroeconomic level playing field. And also, care jobs is not something that is going to be taken over by artificial intelligence anytime soon. So there is that big space over there. The third thing that I want to share with colleagues over here is that, guys, there is a lot of attention and commitment to childcare, particularly in the global commitment. The US government has already committed $39 billion for domestic investment in care infrastructure. USAID has and I have colleagues here from USAID, are prioritizing childcare and care economy as such, and supporting the provision of care services, as well as the caring for carers provision. The World Bank has launched the Incentivizing Childcare Fund, where India is a priority country. Many global foundations, along with multilateral governments, are putting money, around $200 million over the next 5 years, and that pot is growing. So these are opportunities for investors and service providers like us over here to seize. The third big is also what we've been talking about, particularly this morning, that Government of India and state governments are prioritizing women's labor force participation, creation of jobs for women. This is our moment to seize and to position care as an enabler. And I repeat that as one of the enablers, because it's not a cause and effect, but one of the critical enablers for increasing women's economic empowerment. The discussion on childcare has to be center stage. The fourth, of course, in terms of in government context, is that if you're interested in investing in children and young children, then the government's commitment to reducing malnutrition is a big push, and childcare has been a proven model for reducing stunting and wasting rates. So that's another window and a lever to target. And of course, the SDGs. If you're involved in SDG financing, then 2.2, 4.2, 2.2 on nutrition, 4.2 on early childhood care and education, 5.4 on unpaid care work, and of course the 8.5 on decent work conditions. So these are cutting across childcare directly. So that's how we can collaborate.
Thank you so much, Sumitraji. I think you touched upon all the points that I think helps everyone get educated also about the care sector, the need of an intervention that is required here, not just only from donors or public sector, but also private sector. How big is this opportunity? I think we want to really draw the attention to care the way climate got attention. The way green jobs are there, we'll have more care jobs. The way we have a lot of climate investments, we'll want to drive care investments from across the sector. So with that, you touched base upon something around the different innovations that are happening. I would love to talk about, the affordability part. You mentioned one challenge there is care is expensive. Childcare is expensive. And I think here, would love to hear thoughts from Pompiji about the affordability part, the challenges you have seen here, through your work and experience, in the lack of care support that exists, and how does that in turn affects women's health? And then how can we transform that? And some examples of the work that you have done around the affordability in care, if you could highlight that.
Thank you, AVPN, for inviting me and for this great forum to share my thoughts. So at MSD for Mothers, we are supporting to eliminate preventable maternal mortality together with SDG goals. We do focus on quality care and how that is delivered to every woman wherever she chooses to seek care. However, if you all look at what was happening around us during COVID, I think all of us have seen it around us. If we did not have full-time help, we wanted full-time help because we did not want it to be exposed to infection. We did not want part-time help work, so a lot of us just sacked them. Some of us just gave them some money, but no work. And then when the surge came down, we were like, okay, so the part-timers can come back and the full-timers can go, and we can't afford these full-timers. So what was going on? Can you imagine the woman, the healthcare worker, the ayah, the bais, who actually really help us to be economically productive, really running from pillar to pillar, figuring out who the employer would be the next month? In a country of our size and caliber, I think this was, simply something that should make us think about the opportunity that we have to kind of shape this care economy in a more formal manner, so that not only it's about just the patient, the sick, the mothers and the children, but it is overall, how can we kind of look at women being more gainfully employed and to attract women to towards this. And so if you really look at the various stakeholders who can help in defining the policies, so there are these international organizations, the ILOs, on the other hand, it's our government. So let's just look at what those global policy recommendations are, what's World Bank doing, what's being financed, etc., but really translate it to grounds up business models that will help train, skill, test knowledge, which is appropriate to the level of work that they are required to do, and then help them with employment, and also solve for their issues when they are employed or when they need an employment, their retirement and so on. So it has to be a comprehensive set of support that is required, and that to me is care economy that in India I think is in a very, very nascent stage.
Thank you. Thank you. I think at your work at ActionAid, Dipaji, what challenges have you seen, and what support that you would seek from public and private sector organizations on the ground when you work, and especially to support the care work for women?
Thank you, and thanks to AVPN for this invitation and the opportunity. Before I begin, I mean, there is a whole set of challenges across the whole spectrum. But before that, let us understand what is this entire ecosystem. So maybe I'll just speak a little bit on that and what are the possibilities and the opportunities that we see within this entire ecosystem. So when I talk of ecosystem, this ecosystem spans between, since we are talking of care economy here, so this spans between the unpaid work, unpaid which is the care work which is unpaid, the underpaid, and the paid work. So this is the spectrum that we are talking of. And now you situate women across this spectrum. So within the care economy, there's a lot of work which the women do, which is unpaid, completely unpaid. And there's a lot of data, UN Women's data, ILO data, and government's data itself. When we convert this care work that the women does, it converts into trillions of contribution to the GDP. And the amount of time that a woman spends on supporting care work for the families, for the communities, and for the societies, which contributes to the economic activity. So this is like indispensable work for the economic activity that we all can do, which is being supported by women, and this is hidden and invisible because this goes completely unrecognized. So the spectrum of unpaid care work and the underpaid. So now when I talk of underpaid, again there is a lot of work which is paid but not compensated adequately for the work that the women does, and again there is a whole range of sectors I can speak of, and then the paid work. So women are into paid work. I mean, again, we need to understand the data that women are only a small percentage. Now, very recently, Team Lease released a data saying that it is only 12% of women who are in the formal sector have contractual jobs. And so overwhelming majority of the women who are into the paid work, the last category with that I am talking of, are in the informal sector. So in the informal sector, there are again a whole range of issues, which is the value of the work, the dignity of the work, the quality of the work that the women do, even in the paid sector. So I mean, these are the issues, the whole spectrum of issues that I'm just very briefly touching on, but these are really, really very wide. And then coming to what are the possibilities that we can look at. So we in ActionAid, because ActionAid works with women in the range of work. So I can talk of women in agriculture, I can talk of women in construction, women as domestic workers, women as street vendors, women as salt pan workers, poultry workers. Now we can analyze each of these different sectors. Women in agriculture, women in domestic or poultry workers. We have done a lot of research also. In fact, one last research that we did a couple of years back was supported by UN Women only. And that was called Invisible Work, Invisible Workers, which talked about the unpaid, underpaid, and the paid work that the women do. So when you analyze that, let me just take one example of agriculture. Now we often say when we even go to foundations and the donors, and then we say that we work towards ensuring that the women's work in agriculture is recognized. Because women are not recognized as farmers, but a whole lot of work that women do, majority of the work in agriculture is done by women, except certain parts like the plowing, because there is certain taboo attached to it that women should not be plowing the land because you worship the land, you worship the bulls, so women should not be doing that. But beyond that, you look at rice cultivation, the entire seeding, the plantation, all weeding, everything is done by, harvesting is done by women. So this is not recognized. So again, the spectrum of opportunities that I wanted to speak about today is, first is let us recognize this unpaid work that the women do, which is indispensable for the economic activity of any economy or any country. Then second is reduce the work. So reduce the work through various avenues. Now, whether it is now the amount of time women spend in collecting fuel wood. So the energy, the health care, the care for elderly, the care for children, the water, collection of water, even whatever contribution to the livelihoods. So help us to reduce that work of the women, which goes unpaid and underpaid. Then redistribute. The other aspect is redistribute. So how do we bring in men and women to recognize that and help to reduce that unpaid and underpaid work? Because see, this burden of unpaid care work enhances the, loses the opportunities that women get in the other sectors, like the education of girls or the participation of women in other economic activities. So those get further affected because of this work that women do. And lastly, the participation. So the 4 Rs is what we call it: recognition, reduction, redistribution, and participation, representation of women in the various economic. And across this, there are various opportunities which the private sector, the state, and the communities can do to help reduce, and which is what we have been doing. One thing that we do is to collectivize women into groups across all these sectors which I mentioned, form their collectives, form their cooperatives. So the unpaid care work and the underpaid care work can also be socialized. But these are like community mechanisms. And some policy provisions the government has also come up, like for example under the NREGA, the MNREG employment opportunity. So within that there is a possibility for creches. There is a provision for maternity leave. But then as I said, majority of the women are in the informal sector. They are not able to avail these provisions. So how do we ensure implementation of whatever provisions which are available? The POSH, I think, the sexual harassment of women at workplace. So that implementation of that becomes very important, that women get that conducive environment to work. Their economic participation can be supported through effective implementation of these laws. So across these, and technology.
Yeah.
So again, the private sector, government, and the societies can play a very important role across all this. Those are the opportunities, I think. I mean, I can go on speaking a lot, but I'll stop
You have
here.
thrown light upon many, many areas already in terms of opportunities and also how it cut through across the sector. You know, we ran program last year with UN Women to really identify such innovations into the care sector. And how do we empower those entrepreneurs, women-led businesses or women impacting businesses to support the care work and really draw attention on it. So it spread across child care to elderly care to unpaid care, and a lot of work around skilling, capacity building. And one of the enterprises we also had during our program was Titli. We also had a speaker on panel, Pranjal, who is the founder of Titli, and the work they are doing, especially around early childhood educators and the Anganwadis. Would love to hear, Pranjal, quickly if you could share the challenges, like when you started this work and when you were joining this program, what you were seeking, and how such entrepreneurial, capacity building programs help the work in the, in the care sector. So over to you.
Thank you, AVPN, for providing this platform for me to share the thought, and thank you, Anurag. So one, I think care economy is possibly one of the largest possible organized sectors that can be created, that can create employment for women. And to my understanding, India needs approximately 10 million women. That's 1 crore women alone in the early childhood care and education space. And I say this because India has 16 crore children below 6 years of age. And to put it in context, the Indian school ecosystem has approximately 85 to 90 lakh teachers. And that's because the student-teacher ratio in there is, something like 1:50, 1:60. In early childhood, that ratio comes down to 1:10, 1:15. And also, early childhood has a 40% attrition today. And that's something very unique to early childhood because it's a secondary employment, it's not primary employment. And the kind of money that a woman gets in an early childhood center is kind of just okay to possibly help her run her monthly expenses, pocket money. And anything happens, her child gets unwell, her husband gets transferred, something happens to the mother-in-law, the first thing that goes is the job. So I think it's one of the largest skilling opportunities for women employment today. And second is, what Kantaji was talking in the morning about Nari Shakti that is kind of driving the rural India. We have 13.5 lakh Anganwadis, 1.35 million Anganwadis who are actually the biggest influencers in rural India today. And they are the ones who kind of help at least 5 to 7 crore children in rural India. So we at Titli, have a motto of being able to provide a responsive caregiver to every child. And our work is in both the pre-service training of early childhood educators and caregivers to ensure that women get trained as early childhood professionals and get placed with preschools. And second, in rural areas, as in-service training for Anganwadi workers to ensure that they're able to help children be prepared for primary schooling. And, I think, Anurag, the UN Seed Stars program was extremely helpful in two aspects. So we were kind of facing a lot of issues with respect to using technology, to scale our work in rural areas because there's very kind of limited bandwidth and all of that. And also it's a program in early childhood, you need to have mother tongue. You can't have any other language. So because India is so diverse and language issues. And second was to kind of genuinely create a model that can provide sustainable early childhood education to the rural India. And fortunately, today we use a lot of technology, and that's where UN Women and Seed Stars have been very helpful. They brought in a lot of experts. So to use technology and to use SaaS, very low-cost SaaS, to actually create blended models to scale our work currently. And also, we are starting a pilot program currently, which is held by UN Women and Seed Stars, to create rural preschools, which are led by women, rural women entrepreneurs. And if that works, to kind of scale it, because I think India currently needs 5 to 7 lakh rural preschools, and that's an area that's completely empty, which possibly the urban preschools have not been able to touch because it's a very different ecosystem. And I don't know whether a franchisee model will work or anything.
No, thank you.
Thank you so much.
Pranjal. I think, so really, from being an entrepreneur now, how we can use even care to create new micro-entrepreneurship models at the grassroots. That's what I think through the work at Titli, they are driving with the caregivers. I think one thing you mentioned, Sumitra ji, was about care should not only also become, females' responsibility, and how do we ensure that male also equally participate in this? And I think when we were doing this program, there was something our also focus area should be because we were understanding what does even care means. I think there was no clear definition back then around what does a care enterprise mean, what does care entrepreneurship mean, what is care economy all about. So really ensuring that the work that we need to do around care has to be gender inclusive. It cannot be only, it's for female, it's meant for male. No, it has to ensure that male are equally participating in the care sector. And I think would love to now move more towards, we have discussed more of the challenges and the opportunities, but the recommendations, especially the work moving forward, where is the way forward for us. So my next question would be to you, Radha, to see, at RPG Foundation, how do you want to bring care economy to the attention in front of the investors? How do you see it your own work? How do you bring it to the mainstream investment agenda for women economic empowerment? So over to you.
So I think two things that we could do to bring the care economy to the center. One, I think, is legalize, bring more regulation, policy. I think it would help in three ways. One, of course, on the aspect of getting the unpaid labor, which a lot of us here talked about, into the formalized sector, getting them better working hours, fair pay, just bringing that dignity also to the work would help. Regulation and policy would help there. On the receiving side, I think it would help to standardize care. You would be able to access it more easily. And on the government side, as a lot of us touched on, it would grow the economy. So I think it's a win-win, and a huge effort towards bringing it into the formalized sector is one interesting solution. And the other thing, again, I think, as Anurag, you're doing with Seed Stars, I think is bringing entrepreneurship, because I think the only sustainable model is social enterprise. And if we can bring profit models, or invest in profit models that actually drive care economy as a for-profit model, then I think that would be sustainable and bring long-term change. So I think for me personally, I think these are the two avenues that I would hope to work in the future towards, to bring the care economy more in the center.
Thank you. Yeah, I think definitely what we are doing in the program is how do we support this, for-profit interventions around care, and I think soon we'll be launching our new program around care along with Visa and IDRC, Visa Foundation and IDRC. Again, how do we support more women-led and women-impacting businesses around care? So with that, the next question, the same question around recommendations to you, Sumitraji, around the current commitment and innovations made by the national and state governments that you have seen are already implemented and supporting the care work.
Yeah. So in terms of recommendations, I think there are two really clear tracks for us to consider. One is that if we really openly listen to our communities, below poverty line, low income groups, as well as low to middle income groups, they are hungry and desperate for childcare options. Having said that, even the poorest of the poor parent will not let his or her child stay in a childcare facility if the facility is not of decent quality, if the parent doesn't trust with the safety of the child. So which means that the explosion of childcare services across models, from entrepreneurship to publicly funded free models, the whole range is required, and they have to maintain some decent quality and this norms and standards that Radha you were talking about. The second big opportunity and recommendations moving forward is that we work with 6 to 7 state governments and the national government and Niti Aayog on policies and schematic development and costings and things like that. And I'm not speaking on behalf of the government, I'm speaking from our experience with governments, that state governments are hungry for care solutions. Because there is so little on the ground. You go and propose something to them, they will ask you, where is it working? How does it work? What is the change? So that's the point where investors and AVPN community and the wider ecosystem has a responsibility to play on, that this is one sector where increase in supply will lead to greater demand, because the understanding about childcare is so minimal. So therefore, it is actually the no regulation, poor governance could actually be a blessing, because it can seed innovations. It can move things faster, and we should be able to capitalize on that. I'll stop here.
Thank you. I know it gives us a chance to listen to everyone's thoughts and recommendations. So I think over to you, Dipaliji, here around ActionAid. And there is a policy and framework that has been released by ActionAid on the care, and there are some guiding principles that you have. Can you share more light on that? What are those and how they are contributing towards building the care economy?
So yeah, thanks Anurag. As I said, we have been looking at across this spectrum of recognition, reduction, redistribution, and representation of women. And across this, we have analyzed several existing policies and the legal provisions which are available, and how do we make them gender responsive. So within the reduction thing, a whole set of things which can be done by creating, supporting, funding for financing for gender responsive public services. So that helps to reduce to a great extent the amount of time that a woman spends on unpaid and the underpaid care work. So when I say gender responsive public provisions. It means support for energy, the energy transitions that we are talking of now, the climate transitions, how it is more gender responsive, how does it support women. Similarly, mobility, transportation, support for water collection. Again, we heard in the previous panel about the provisions. So, helping in reducing women such time spent on is something we are pushing for. But beyond that, I mean, because recognition is a very important aspect, I would personally, I mean, like to push for a national campaign on the lines of like we have the Swachh Bharat Abhiyan, or we have the Atmanirbhar Bharat. Why not have a national campaign which recognizes women's, which celebrates women's work in the world of work or the entire spectrum of work, and then effective implementation of various progressive policy provisions which are already there. Again, I mentioned a lot of them. Gender, the pay gap still continues to be there because we work with women. I spoke of several sectors. Again, there is, when a man is getting 300, the women will be getting 250. This still exists in our country. So that differential wage payments, I think there is a equal payment minimum and wage and equal wage payment law is there. Effective implementation of that. Effective implementation of creating conducive work environment for the women, the crèche facilities that again, these are there in many of the existing. So creation of new care jobs, I think this is another thing which we have been pushing for. Rural employment, I already mentioned there is a provision, but now since many of the state governments have taken up urban employment, how do we create those kind of care jobs within the employment schemes is some of these things. And lastly, also a call for men and boys to participate and help in reduction and redistribution of the unpaid and the underpaid job that the women do.
I fully agree. Great points. I think with that, one final, recommendation from you, Pompiji, around the work that you have been doing at MSD for Mothers, especially the interventions care sector and the maternal health care sector has, and how does the care work can actually also support the maternal health care ecosystem. So if you could throw light on those recommendations.
Yeah, thank you, Anurag. So I think at the end of the day, we want to ensure that there is accessible, affordable, and quality care available to each woman across wherever she lives, wherever she seeks to choose care. So I think it's important to standardize curriculum for trainings of these various cadres of workers, train them, test them, and then empower them with transformative policies that not only include everything that we talked about, but also maternity and paternity leave. And I am, I've been supporting gender-inclusive policies everywhere. One of the reasons that possibly women get paid less is because, we do not have enough men doing, in the care economy. Whereas if you really go and look at, demand for men in care economy, there is quite a bit of it. So I think some transformative policy is required, including, ensuring that they are skilled, they are placed, and they have, they are also mainstreamed in a manner that, all the other folks are. But I think there is room for a lot of innovation here, given that, one of our investments earlier on in India, Eco Platform, is being used by the government and the private sector in a big way to skill people, and Skill India is also, the Prime Minister's mission at this point. I think it is right time, that we can ride the digitization to sort of skill, test, and at scale to kind of cater to the demand in country and out of the country, ensuring folks get jobs, as well as ensure that we are benchmarking quality at every step.
Thank you. I think we have heard these great inputs, a lot around skilling, policies, new entrepreneurial innovations, but it's not something that can be done alone. Different organizations, all the stakeholders that are involved in the care ecosystem really has to come together and come up with new ways of doing business in the care. What collaborations possibly these panels and these opportunities can bring into the care sector is something would love to see how it really materializes, post these events. Before we do just the last, how are we doing on the time? And we're, any questions from panel or from the audience can we take? Yeah, 2 questions. Yeah, we have one from Karthik and then one in the end. Please go ahead.
No, thank you for the panel. Just a quick question. One is on national accounts. Can we include care in that, in GDP? It's been estimated that 3% of GDP comes from that. Are there any efforts with government to talk about that? And the other is linking it to blended finance. In the West, we have these social impact bonds, development impact bonds, on workforce development. And often it's about, well, like in New York, for example, women from, let's say, Brooklyn or underprivileged backgrounds, workforce retention, so giving them access to creches and support at the work, and the metric that's tracked is their retention in the job. Could that concept be applied in India? Or emerging markets?
Yeah, I'll take the question on blended finance, and I think you're right. I mean, defining those metrics, and essentially that's what is lacking in India. We are not testing the skills and knowledge, and we are not able to do that matchmaking of demand and supply. And defining that, training folks on that is what Skill India is aiming to do, and that will go a long way in getting such instruments of blended finance. Actually, take some of these, promising initiatives to scale and address where the real challenges are. If you really ask in those northeastern states, Meghalaya, Assam, the issue is with the quality of community health workers. The issue is with the quality of care or the content of care that folks get, right? So it's not always the volume, it's also the quality, and I think that is something that we need to focus on and embed in all the interventions when it comes to care economy.
Thank you. Last question.
Hi, I'm Priya. I'm from Make a Difference. We work with children in need of care and protection. So my question is this. Of course, we have policies, we have corporates who are looking at including men in providing care. But that's basically for the middle and upper middle class. What happens, for the low-income communities, especially we see that poverty is one of the major reasons why children end up in childcare institutions in the first place. So how do we, support these families in making sure that the children in these communities are taken care of?
Yeah, please, Sumitra.
Isn't that the whole point of this discussion? Because that is the biggest gap, right?
Base of the pyramid.
And so, I mean, that's the reality, and there is a top-down and a bottoms-up approach. There is no childcare policy. There are no norms and standards. There are minimum guidelines notified by the government, but that's applicable to the formal sector. The population that you're not talking about is not covered under under that sector, and there are no budgets for the kind of population that we are talking about. So what can we do? I think this is an ecosystem approach. This is a collective approach that first we deepen our own understanding about what quality childcare means. Dipali spoke about Narega creches. Narega, as per law, mandates a disabled woman worker sitting under a tree with the children of Narega working mothers with a pot of water. That's a creche under the law, okay? So if that is the start point, we have a very long way to go to where the government of Haryana is creating publicly funded 1,000 creches across the state for urban working women, looking at desirable norms, and the costing per creche is now, we are talking about 8.5 to 9 lakhs a year for a unit of 25 children. So all I'm saying is that there is this and there is that, and then there is all of us here who can intervene wherever we can to make that difference, whether it's regulation or policy or actual services, training, quality monitoring, community, local level solutions to bring in the change.
Thank you. I think there's a big spectrum to be filled into when it comes to the care work, and especially if you want to make care economy the next thing. And to do that, again, it can't be done alone. Need really support from everyone, from social enterprises to the governments to private sector investors to entrepreneurs building the care enterprises of the future. So with that, I would like to thank all of you, the fantastic panel, great points, recommendations, and the opportunity that is out there in the care sector. Thank you for highlighting that. So with that, thank you so much, everyone, for being a great audience.